Hello, my name is Jordan Halsey. I'm a pediatric plastic and craniofacial surgeon at JohnsHopkinsAllChildren'sHospital. I would like to discuss the diagnosis of cleft palate and provide an overview of the condition, ways we overcome feeding difficulties in early infancy, and our surgical management here at Johns Hopkins All Children's Hospital. Our JHACH plastic surgeons are cleft and craniofacial fellowship trained academic providers and look forward to meeting with you to help in your child's care. Cleft palate is one of the most common craniofacial diagnoses that we see in infants, and oftentimes is associated with a cleft of the lip and gum line. Once a cleft palate is diagnosed in infancy, it is important to contact our cleft and craniofacial team for evaluation as soon as possible in order to ensure all relevant team members are able to get involved early in your child's care. This oftentimes includes pediatric ear, nose, and throat if there are other airway concerns, along with speech and feeding providers who can assist in providing appropriate bottles and education to ensure that your infant is able to feed and grow appropriately. In patients with a cleft only of their palate, we also typically recommend an evaluation by the genetics team to evaluate for associated syndromes or other conditions that can accompany a cleft palate diagnosis. The palate is an important structure for both feeding and speech. In most patients, we plan for cleft palate repair by around 1 year of age to prevent delays with speech development. The palate repair is performed in the operating room and typically takes 2 to 3 hours. It can be combined with ear tube placement by ENT if needed, as many children with cleft palates are at higher incidence for ear infections. Our team will assist in referring your child to ENT to monitor your child's middle ear status and possible need for ear tube placement prior to scheduling their palate repair. Palate repair allows for the muscles involved with speech production to be appropriately repositioned so that they can function well during speech. Absorbable sutures are used to close the palate in multiple layers. The patient is then observed in the hospital following the surgery to ensure that they recover well and are able to feed appropriately following repair. Once they are discharged home, patients remain on a liquid diet until cleared to return to soft foods by their surgeon. Our team then follows patients throughout their first few years of life to ensure that there are no further concerns with speech production, as around 10 to 20% of patients with cleft palate may need other speech surgeries in the future. If your child has a cleft palate, our team would love to be involved with their care and answer any questions or concerns that you may have. We look forward to getting to know you and your child better and introducing you to our cleft and craniofacial team.